Hi, my name is Alexis Connolly, and I will be discussing diet and nutrition in relation to HPV-driven cervical cancer. Cancer is the second leading cause of death in the United States behind heart disease. There are several types of cancer that affect women specifically, including breast cancer and cervical cancer. Specific meal plans, diets, and other dietary supplements have been used to treat and prevent the occurrence of these types of cancer. My goal for this research project is to research and determine whether diet and nutrition can be used as a sufficient method for preventing the occurrence of cervical cancer in women. Cervical cancer is a disease involving the abnormal growth of cells within the cervix or the region of the uterus that connects to the vagina. Cervical cancer affects nearly 12,000 women, and more than 4,000 women die from the complications of this disease every year. Before the institution of regular pap smears by the OBGYN, cervical cancer was the leading cause of cancer deaths in women. Due to the high numbers of HPV cases in developing countries, cervical cancer rates are still the leading in cancer deaths compared to breast cancer. The purpose of this research prospectus is to determine how diet and nutrition affect the occurrence of cervical cancer and to provide information to medical professionals and students for the betterment of women affected by cervical cancer. Based on the information from the research articles I have collected, there are multiple studies with different conclusions in relation to the issue of diet and nutrition and its effect on cervical cancer prevention. In two studies, researchers found that when the body is deficient in folate and B12, the synergistic activity between them could be causing cervical cancer. There is also research to suggest that low fruit consumption and low folate levels reveal precursor genes for women's risk of cervical cancer. The environment within the cervical area could also be affected and made more vulnerable to cancer by the consumption of a diet containing high fat foods. Other studies suggest that diet and nutrition has no discernible effect on women's cancer risks. However, majority of the research recommends a balanced diet for the prevention of cervical cancer. My research question is to determine if diet and nutrition is an effective treatment option for preventing and treating the occurrence of cervical cancer in women with HPV or human papillomavirus. For my research design, I would be conducting a one-group pre-test post-test study using an internet-based survey. This research design works for the research question I propose because my research is a descriptive study. I would like to distribute 3,000 surveys and expect to get about a 50% expectancy rate of return. The research study performed will include retrospective data that is mostly clinical data. Due to the fact that the study is focused on disease prevention, I will have to consult other epidemiology studies and clinician data. The population from which I am sampling are women of childbearing age diagnosed with HPV, and a sample size of over 500 would be preferred. Due to the gravity of the test subject requirements, all identifiable information will be kept private unless participants choose otherwise. For the statistical analysis, I have chosen to use an independent t-test where the independent variable is the intake of folate and vitamin B12 and the dependent variable is the synergistic activity. The test would be to determine the probability of cervical cancer occurrence. occurrences from the synergistic activity caused by the intake of folate and vitamin B12. Research on the specific elements that are useful in preventing cervical cancer will be included as a means to provide information to medical professionals and students in order to better the lives of women affected by this disease. Research is lacking when it comes to the female reproductive system. There needs to be a greater awareness of the issues and complications that affect women every day. If the amount of research on gynecological cancers increases, medical and nutrition professionals will be better suited to help women suffering from these diseases. Having more knowledge on the subject of preventative measures could save more lives in the future and lead to future discoveries of a cure. Limitations to this study include the fact that the specific sample type limits the amount of participants and the amount of data collected. Throughout the study, I will be using research from different scholarly sources and research articles. I must be sure not to choose research that deliberately provides bias on a certain position during my research, and I must pay attention to the parties funding the research articles I decide to use to make sure that my information from my data is not biased. In future research studies, I recommend that investigators perform similar experiments on women without HPV. I also recommend an experiment where investigators determine whether physical fitness and activity has a role in the prevention of cervical cancer as well.